If you're over 50 and you've recently felt that sudden, sharp pull in the back of your thigh, you know exactly how frustrating and uncomfortable a pulled hamstring can be. Maybe it happened while you were gardening, reaching for something, or simply taking a longer walk than usual. One moment you felt fine, and the next, there's this nagging pain that makes even sitting down feel like a chore. The good news is that for many mild to moderate hamstring strains, there are gentle, supportive steps you can take right at home to encourage your body's natural recovery process. Today, I'm going to walk you through a simple, step-by-step approach that may help you feel more comfortable and get back to your daily activities with greater ease. We'll go nice and slow, and I'll give you easier options along the way if you need them. Hello, my friend, and welcome back. I'm Dr. Sarah Truman. Before we dive in, I want to be very clear about something important. I'm a health coach and wellness educator. I am not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before starting any new exercise, changing your routine, or trying anything I mentioned today, especially if you have any health conditions or take medications. Your doctor knows your personal situation best, and nothing I say here replaces their guidance. This is especially important with any kind of muscle injury because some strains are more serious than others, and only a medical professional can properly assess what's going on in your specific situation. Now, let me tell you what we're going to cover today. We're talking about pulled hamstrings, which is one of the most common muscle injuries, especially as we get older. A pulled hamstring can really slow you down. It can make walking painful, sitting uncomfortable, and getting in and out of a car feel nearly impossible some days. But many people find that with the right approach, their bodies can recover quite well over time. Here's what we'll go through together. First, I'll explain a little bit about what's actually happening in your body when you pull your hamstring and why this tends to happen more as we age. Then, I'll share 4 gentle, practical approaches you can use at home to support your recovery. After that, we'll talk about some common mistakes people make that can actually slow down their healing. And finally, I'll let you know which warning signs mean you should see a doctor right away. Does that sound good? Let's get started. So what exactly is a pulled hamstring and why does it happen? Your hamstrings are actually a group of 3 muscles that run along the back of your thigh, from your hip down to just below your knee. These muscles help you bend your knee and extend your hip. They're involved in almost everything you do, from walking and climbing stairs to bending over to pick something up. When we say someone has pulled their hamstring, we usually mean they've strained one or more of these muscles. A strain happens when the muscle fibers get stretched too far or even tear slightly. This can occur during a sudden movement, like quickly reaching for something, or it can happen gradually from overuse. Sometimes it's simply a matter of the muscle being cold or tight when we ask it to do something strenuous. Here's something important to understand. As we get into our 50s, 60s, 70s, and beyond, our muscles naturally lose some of their elasticity and strength. Think of it like a rubber band that's been used for many years. It still works, but it's not quite as stretchy or resilient as it once was. This is completely normal and nothing to be alarmed about. It just means we need to take a bit more care with how we move and how we help our bodies recover. The good news is that muscles have an amazing ability to repair themselves. Your body is constantly working to heal and regenerate tissue. What we want to do is support that natural process by giving the muscle what it needs to recover while avoiding things that might slow it down or cause further irritation. You're not alone if you're dealing with this. Hamstring strains are incredibly common, especially among adults over 50. Many of my viewers have told me they've dealt with this at some point. The key is to be patient with yourself and take a gentle, consistent approach. Small, careful steps often lead to better outcomes than trying to push through the pain or do too much too soon. Now let's talk about the first thing that may help support your recovery, and that's the immediate care you give your hamstring in the first few days after the strain. This initial period is really important because it sets the stage for everything that comes after. In the first 48 to 72 hours after you feel that pull, your body is responding to the injury with inflammation. Now, inflammation sometimes gets a bad reputation, but it's actually your body's natural healing response. Blood flow increases to the area, bringing nutrients and cells that help repair the damage. However, too much swelling can cause discomfort and may slow things down, so we want to find a balance. The first step is to rest the muscle, but not complete bed rest. Gentle movement is actually good for recovery, but you want to avoid anything that causes sharp pain or puts significant strain on the hamstring. This means taking a break from activities like brisk walking, climbing lots of stairs, or any exercise that involves extending or stretching the back of your leg forcefully. The second step is to apply something cold to the area. You can use an ice pack, a bag of frozen vegetables wrapped in a thin towel, or a cold gel pack. The key is to never put ice directly on your skin because that can cause irritation. Always have a layer of fabric between the cold source and your body. Apply the cold pack for about 15 to 20 minutes at a time, and then remove it for at least an hour before applying again. Some people find that doing this several times a day in the first few days helps reduce discomfort. The third step is gentle compression. If you have an elastic bandage, you can wrap it lightly around your thigh to provide some support. The wrap should be snug, but not tight. You should be able to slip a finger underneath it easily. If you notice any numbness, tingling, or increased pain, remove the bandage immediately because it may be too tight. The fourth step is elevation. When you're sitting or lying down, try to prop your leg up so that your thigh is at or slightly above the level of your heart. You can use pillows to create a comfortable position. This may help with swelling and can make you feel more comfortable overall. Now here's an important safety note. If the pain is severe, if you heard a loud pop when the injury happened, if you notice significant bruising or swelling, or if you're having trouble putting any weight on your leg at all, please see a doctor before trying anything at home. These could be signs of a more serious injury that needs professional evaluation. Listen to your body. If something doesn't feel right, it's always better to get it checked out. Take your time with this initial phase. I know it can be frustrating to slow down, but giving your body this window of gentle care at the beginning can make a real difference in how you feel in the weeks to come. Now that we've covered the initial care, let's move on to something else that can help, and that's gentle stretching and movement. After the first few days, when the initial discomfort has started to settle down a bit, introducing some very gentle movement can be beneficial for many people. Movement helps maintain flexibility and can prevent the muscle from getting too stiff. But here's the key, and I really want you to hear this. When I say gentle, I mean very gentle. This is not the time to push yourself or try to achieve a deep stretch. You want to feel a mild, comfortable stretch sensation, not pain. If anything causes pain, stop immediately. Let me describe a simple seated hamstring stretch that many people find helpful. First, find a sturdy chair and sit near the front edge. Sit up tall with your feet flat on the floor. Now extend one leg out in front of you with your heel resting on the floor and your toes pointing up toward the ceiling. Keep that leg as straight as is comfortable, but don't lock your knee. Your other foot stays flat on the floor with your knee bent. Next, keeping your back straight, very gently lean forward from your hips. You're not trying to curl your spine or reach for your toes. Instead, imagine you're trying to bring your belly button toward your thigh. Lean forward only until you feel a very mild stretch in the back of your extended leg. Hold this position for about 20 to 30 seconds while breathing slowly and deeply. Then, slowly sit back up and relax. You can repeat this 2 to 3 times on the affected leg and then switch to do the other side as well. Keeping both legs flexible is a good idea. If sitting at the edge of a chair feels unstable, try this instead. Sit all the way back in the chair with your back supported. Extend one leg straight out with your heel on the floor and simply hold that position. Just having the leg extended can provide a very gentle stretch for some people. Another option is a lying down stretch. Lie on your back on your bed or on a yoga mat on the floor. Bend one knee and place that foot flat on the surface. Your other leg stays extended. Gently slide the extended leg along the surface, straightening it as much as is comfortable. You might feel a very mild stretch behind your thigh. Hold for 20 to 30 seconds, then relax. Remember, no pain. If this causes discomfort, don't push it. A safety note here. If you have any balance concerns, make sure you have something sturdy nearby to hold on to when getting in and out of positions. And if getting down to the floor is difficult for you, stick with the seated version. There's no need to get on the floor if it's not comfortable or safe for you. These stretches are best done when your muscles are a little warm, perhaps after a warm shower or after a few minutes of very gentle walking around your home. Try to do them once or twice a day, but listen to your body. Some days you might feel better than others, and that's completely normal. Here's another thing that often helps as you progress in your recovery, and that's gentle strengthening exercises. Now, I want to be very clear that strengthening should only be introduced gradually, usually after the initial pain and inflammation have significantly calmed down. For some people, this might be a week or two after the injury. For others, it may take longer. Everyone's body is different, and healing happens at its own pace. Strengthening the hamstring and the surrounding muscles can help provide better support to the area, which may reduce the risk of re-injury down the road. But again, we're talking about gentle, low-intensity movements here. One simple exercise is called a standing leg curl. You'll need a sturdy chair or counter to hold on to for balance. Stand behind the chair with both hands resting on the back for support. Shift your weight onto one leg. Now slowly bend the knee of your other leg, bringing your heel up toward your bottom. You don't need to bring it all the way up. Just go as far as is comfortable without any pain. Hold for a second or two at the top, then slowly lower your foot back down. That's one repetition. Try to do 5 to 10 of these very slowly and controlled. Then switch legs. If this feels too easy after a week or so and there's no pain, you might gradually increase to 15 repetitions. Another helpful exercise is a bridge, but we're going to do a very gentle version. Lie on your back with your knees bent and your feet flat on the floor or bed, about hip-width apart. Your arms rest at your sides. Slowly lift your hips just a few inches off the surface, squeezing your buttock muscles gently. You don't need to lift very high. Just a small lift is enough. Hold for a second or two, then slowly lower back down. Start with 5 to 10 of these, focusing on slow, controlled movements. If you feel any strain or discomfort in the back of your thigh, stop and try again another day when you're feeling a bit stronger. Here's a modification if the bridge feels too challenging. Instead of lifting your hips, simply press your feet gently into the surface as if you were going to lift up, but don't actually lift. Hold that gentle press for 5 seconds, then release. This activates the muscles without putting as much demand on them. Skip these strengthening exercises if you're still in significant pain, if the area is still very swollen, or if your doctor has told you to wait before doing any resistance exercises. There's no rush. Building strength is a gradual process, and it's better to start too easy than too hard. Before we move to our next point, I want to address something that many people find helpful for comfort during recovery, and that's the use of heat therapy and gentle self-massage. After the first few days, once any initial swelling has calmed down, some people find that applying warmth to the area can feel soothing and may help relax the muscle. You can use a warm towel, a microwavable heat pack, or a warm water bottle. Make sure whatever you use is warm, not hot. You should be able to hold it comfortably against your skin without any burning sensation. Always wrap heat sources in a cloth or towel to protect your skin. Apply the warmth for 15 to 20 minutes at a time. Many people find this especially helpful before doing their gentle stretches because it may help the muscle feel a bit more relaxed. Now let's talk about gentle self-massage. Using your hands to lightly massage around the affected area can feel very nice and may help increase blood flow to the region. Here's how to do it safely. Sit in a comfortable position with your leg relaxed. Using your palms and fingers, very gently stroke along the back of your thigh, moving from just above your knee toward your hip. Use light to moderate pressure only. This should feel soothing, not painful. If pressing on any spot causes sharp pain, avoid that area. You can also try making small circular motions with your fingertips along the sides of your thigh, avoiding pressing directly into the most tender spot if there is one. Spend about 5 minutes doing this gentle massage once or twice a day if it feels good to you. A word of caution: if you have any blood clotting conditions, if you're on blood thinners, or if you have varicose veins in the area, please talk to your doctor before doing any self-massage. Also, never massage an area that is significantly swollen, bruised, or very painful to touch. Some people also find that gentle foam rolling can be helpful later in recovery, but I'd recommend waiting until you're feeling significantly better and checking with your doctor or a physical therapist first, especially if you've never used a foam roller before. Now I want to share something that many people overlook when they're recovering from a muscle strain, and that's the role of nutrition and hydration. Your body needs certain building blocks to repair muscle tissue, and what you eat and drink can play a supportive role in your recovery. First, let's talk about protein. Protein provides the amino acids that your body uses to repair and rebuild muscle fibers. Good sources of protein include eggs, fish, chicken, lean meats, beans, lentils, Greek yogurt, and cottage cheese. You don't need to dramatically increase your protein intake, but making sure you're getting adequate protein with each meal can be helpful. Second, staying well hydrated is important. Water helps transport nutrients to your cells and carries away waste products. When you're recovering from any kind of strain, your body is working hard behind the scenes, and it needs adequate fluids to do its job. Aim to sip water throughout the day. Herbal teas and water-rich foods like cucumbers, watermelon, and soups also count toward your hydration. Third, certain nutrients may support the body's natural repair processes. Vitamin C, found in citrus fruits, strawberries, bell peppers, and broccoli, plays a role in collagen production. Zinc, found in nuts, seeds, and whole grains, supports tissue repair. Omega-3 fatty acids found in fatty fish like salmon and mackerel, as well as walnuts and flax seeds, may help support a healthy inflammatory response. I want to be clear that I'm not telling you to take any supplements. Some supplements can interact with medications or may not be appropriate for everyone. If you're interested in supplementation, please talk to your doctor or a registered dietitian who can give you personalized guidance based on your specific health situation. The bottom line is that eating a varied, balanced diet with plenty of vegetables, fruits, lean proteins, and whole grains gives your body a good foundation to support its natural healing processes. And don't forget to get enough rest. Sleep is when a lot of repair work happens in your body, so prioritize good quality sleep during your recovery. Now let's talk about some common mistakes and myths that can actually slow down recovery from a pulled hamstring. I see these quite often, and I want to help you avoid them. The first mistake is pushing through pain. I understand the temptation. You want to get back to your normal activities. You don't want to feel limited. But when it comes to muscle strains, pushing through pain is one of the worst things you can do. Pain is your body's signal that something isn't right. If you ignore it and keep going, you risk making the injury worse or turning a minor strain into a more serious tear. It's so much better to back off, rest, and let your body heal properly than to extend your recovery by weeks or even months. The second mistake is being completely sedentary. On the opposite end of the spectrum, some people think that complete rest and not moving at all is the answer, but too much inactivity can actually lead to stiffness, muscle weakness, and slower recovery. The key is finding that middle ground. Gentle movement, as tolerated, helps keep blood flowing to the area and prevents your muscles from getting too tight or weak. Just make sure the movement is gentle and pain-free. The third myth I want to address is that you should stretch aggressively to work out the injury. Some people think that if they just stretch hard enough, they can force the muscle to heal faster. This is not true and can actually cause more damage. In the early stages of a strain, the muscle fibers are vulnerable. Aggressive stretching can tear them further. Always keep stretches gentle and never stretch to the point of pain. Another myth is that heat is always better than cold, or that cold is always better than heat. The truth is that both have their place. In the first couple of days after an injury, when there may be swelling, cold is generally more helpful. After the initial phase, when swelling has subsided and the muscle feels tight or stiff, warmth may be more soothing. Some people find that alternating between the two works well for them later in recovery. Listen to your body and see what feels best for you. Finally, some people believe that once the pain is gone, they're fully healed and can jump right back into all their normal activities. But pain often goes away before the muscle is fully recovered. Returning to demanding activities too quickly is a common cause of re-injury. Take your time, build back up gradually, and give your body the respect it deserves. Before we wrap up, I want to talk about when you should see a doctor. While many mild hamstring strains can be supported at home with the gentle approaches we've discussed, some injuries need professional medical attention. Please see your doctor or seek medical care if you experience any of the following. If you felt or heard a pop at the time of the injury, this could indicate a more significant tear. If there is significant bruising or swelling that develops quickly, if you're unable to bear weight on the leg at all, if the pain is severe and doesn't improve with rest after a few days, if you notice any unusual lumps, bumps, or deformities in the muscle, if you have numbness, tingling, or weakness in your leg or foot, if you develop a fever along with muscle pain, which could indicate an infection, or if you're simply not seeing any improvement after a couple of weeks of gentle care. Trust your instincts. If something doesn't feel right, it's always better to get it checked out. Your doctor may want to do a physical examination or possibly imaging like an ultrasound or MRI to see what's happening inside the muscle. If the strain is more severe, they might recommend physical therapy with a trained professional who can guide you through a personalized recovery program. Please also remember that if you experience any symptoms that feel like an emergency, such as severe pain, sudden swelling in your leg, difficulty breathing, or chest pain, seek immediate medical attention. These could be signs of something more serious that needs urgent care. Let's quickly recap what we covered today. First, we talked about initial care in the first few days, which includes rest, applying cold packs, gentle compression, and elevation to help manage discomfort and support your body's healing response. Second, we discussed gentle stretching and movement to maintain flexibility, always keeping it mild and pain-free. Third, we explored gentle strengthening exercises to gradually build support in the muscle once the initial pain has calmed down. Fourth, we looked at heat therapy, gentle self-massage, and the supportive role of good nutrition and hydration. Remember, you don't have to do everything at once. Start with whatever feels most manageable for you. Maybe that's just focusing on rest and cold packs for the first few days, then gradually adding in gentle stretches as you feel ready. Small steps add up over time. Be patient and kind with yourself. Recovery is a process, and everyone's timeline is different. What matters is that you're taking care of yourself and listening to your body. If you found this information helpful, I'd be so grateful if you'd give this video a thumbs up. It really does help other seniors find this content, and that means a lot to me. And if you're not subscribed yet, consider joining our community. I share new videos every week with practical tips and gentle guidance to help you stay strong, independent, and feeling your best as you age. There's a whole library of videos here waiting for you on topics like joint comfort, better sleep, balance and stability, and so much more. If you'd like to keep going after this video, I'd recommend watching my video on gentle leg exercises for seniors. It's a great complement to what we talked about today and can help you build overall lower body strength in a safe, comfortable way. I'll put the link on screen and in the description so you can find it easily. Thank you so much for spending this time with me today. I truly appreciate you being here. Take care of yourself, be gentle with that hamstring, and I'll see you in the next video.